Hello, my name is Jay Ashball, and I am here to discuss with you the transition of the Baytown Employee Wellness Center from Concentra to CareHere. I would like to first start by going into a little background of who CareHere is. Currently, CareHere manages about 130 clinics in more than 20 states. These states include Texas, Montana, Maryland, Georgia, Florida, and Arizona. At the present time, we provide medical services to more than 85,000 employees and more than 190,000 patients. Um, At CareHere, a big part of what we bring is wellness. You can go to any doctor's office and get um, acute care services. So one major difference that you're going to see with the CareHere clinic is our commitment to our wellness program. So a little bit about the details of the transition. First of all, services at the clinic are going to remain at no cost to patients who are covered under the United Healthcare Insurance Plan. For those who are not insured by the United Healthcare Plan, you will be able to access the clinic as before by paying a $50 copay. You will receive in the mail a United Healthcare Wellness card that states that it's a wellness clinic only. If you bring the card in, you can use the services again for a $50 copay. CareHere has retained the current employees of the healthcare center, Rochelle Silverthorne Kramer and Sherby and George, as part of the CareHere team. In addition to that, we will be adding an MD. Dr. Olafunke Odatunde will join our team in April, and she will be seeing patients at the clinic about 1 day a week. As before, the clinic will be open to patients who are 2 and up, and one addition, we will be doing school immunizations at the clinic prior to the upcoming school year. The current hours of the clinic are going to remain the same, so we're looking at Monday and Thursday, 7:30 to noon and 1 to 4:30. On Tuesday and Wednesday, the clinic will be open from 9:30 to noon and 1 to 6:30, and on Friday, the clinic will be open from 8 to noon and 1 to 5. As before, the clinic will be closed from noon to 1 for lunch. One difference that you will notice is the way that appointments are scheduled between the current clinic and when CareHere takes over. Currently, the clinic has appointments every 30 minutes, so at 8, 8:30, 9, on the half hour, and on the hour. With our schedule, we will have appointments scheduled every 20 minutes. So there will be an 8, an 8:20, an 8:40, and so on. What this will allow is for extra appointments during the day and for increased appointment times at times that you currently do not have appointments. Occupational services will also continue to be offered at the clinic. The clinic is the first stop for any workplace injury because this is where the post-accident drug screen will occur. For any type of injury care for the initial injury, you may walk into the clinic. All other appointments do need to be scheduled. The way that these are done is that if there is an 8:20 appointment and you walk in at 8:15, your injury will be assessed, and on the severity, you will be taken either before the 8:20 appointment or after. If we do take a workplace injury before an appointment, we will discuss with the individual who had that 8:20 appointment and let them know that there is currently a workplace injury, that because of the severity of the injury, we need to see them at that time, and let them know if we were able to see them or if we have to reschedule. So appointments can be made either through our website at www.carehere.com or through our 877 help desk number, 24 hours a day, 7 days a week. Another benefit to the clinic is that if you do continue to use your current provider and they give you blood work orders, if it's on a LabCorp requisition only, you may bring that into the clinic and have those drawn for free. Currently, if you go to a LabCorp lab, you can get your blood drawn, and then about 3 or 4 weeks after that, you're going to receive a bill for them for their services. If you get your blood drawn at the clinic, there will be no additional cost for you. At CareHere, we strive to stay on time during the clinic. We know that your time is valuable, and we value your time. So we do have a 10-minute reschedule policy, which means if you're more than 10 minutes late to your appointment, we will ask you to reschedule. Along with that, the city has instituted a no-show fee, which will begin on March the 1st, and it's $20 for any appointment missed. Now, again, you can make appointments or cancel appointments online or via the help desk. The one thing about our system that is really nice is that you can cancel at any time. A lot of time at doctor's offices, you must cancel 24 hours prior to your visit, not with CareHere. You may cancel up to 1 minute before your visit. So if you have a 9 o'clock appointment, as long as you have canceled before 9 o'clock, you will not incur the no-show fee. policy that we do have in place at the clinic is that if you do need a medication refill, you will have to make an appointment and see a provider. So, for example, if you have a med currently, or you get a med and you get 4 refills, once you get through the 4th refill, you will have to schedule an appointment with the provider, discuss your current health, things of that nature, how the medication is affecting you and how it's going, and then she will be able to give you continued refills. This is a healthcare clinic that we are opening, so be it that we must follow all confidentiality laws and HIPAA. So what that means is that none of your personal health information will be shared with the city of Baytown. Everything will be in the CareHere EMR, and it will be held in strict confidence for you and for the CareHere staff. Again, a big part of what CareHere brings to the table is our wellness program. To that, we have a registered dietitian and a registered nurse on staff who are available to all patients of the clinic with no out-of-pocket cost. So how this works is that you would see our provider and they would refer you to see our registered dietitian or our nurse. And for example, you could be wanting to lose weight, so get on a weight loss program. The provider would give you our information about CareHere Connect, which we will go into shortly. And then you can log in there, but then you will also get updates from our dietitian, and she will discuss things with you about your plan and possible exercise programs and eating healthy and things of that nature. She will communicate with you via phone or via email, so it's very convenient, whatever works best for you and your schedule. Next, I would like to talk a little bit about CareHere Connect. Again, this is something that you would be referred through your provider once you needed to get on some type of plan or track. Some of the things that you might want to work on would be if you have high blood pressure or high cholesterol, or again, if you're looking for a weight loss program. Once you're registered in our system, you will have access to CareHere Connect. You will see a green bar on the left side of the web page of the EMR. At the bottom under report module, it will say CareHere Connect. You can click on that, and as you can see in the slide, it will pull up our CareHere Connect web page. And through here at the top, you can see it says My Health and My Task, My Plans. It gives you different tasks and plans on a daily basis on how to get to the goal that you are trying to reach. So if your goal is weight loss, it will give you exercise routines and healthy eating tips and things of that nature. Along with that, if you are on the run, we do have a CareHere app for CareHere Connect. So once you are registered and you get onto CareHere Connect, you can download the app on your phone and have it right there at your fingertips at all times. So next I'd like to talk about getting registered as a patient. To have access to any of our clinics or to the clinic, you must be registered. So to register, it's a very simple process. First, you'll see at the top left, you'll see our homepage, and there'll be the member login. You click there. The next page will come up and you'll need to click on I need to register for a new account with an access code. Once you click on that, it's going to bring up the screen that you see at the bottom left, and it's going to ask you for your access code, which you can get from your HR department. What this access code allows us is it shows us that you are an employee of Baytown and that you can have access to the Baytown schedule and everything in their EMR. At that point, you will have to agree with our confidentiality statement again. And then it's going to give you some general information to fill. So at that point, you're going to put your social security number and you're going to create your username and your login. And it's going to ask you for an email address as well. So a couple things. First of all, we request that you use your personal email address. That way, anything that comes to you is between you and CareHere and it's held in confidence. Second, if you're registering your spouse and your dependents, you must register everybody separately. So if you have let's say it's you and your spouse and a child, you must have 3 different logins. You must register 3 different times. For any dependents, kids, you must also put their social security number in and yours. Once you fill out this information, at the bottom of the page, you're going to need to click the update button. At that point, it's going to take you back up to the top of the page, and you will see the circled button and the red arrow for next page. This is an extremely important part in the registration process. If you just click the update button and then stop, once you try to log back in, your username and password will not be active. To ensure that your username and password are active and you have access to the clinic, you must click the next page button. This will register you. It will also take you to the next page, which is going to ask you for some general health information. You're going to go through here and fill out your history. And what this will do is it will be in your chart, and the provider at the clinic will have access to it anytime that you come in and pull you up. So at this point, at the bottom, when you hit update, you are going to be registered with CareHere and be able to schedule appointments at the clinic. So the next thing would be, how do you schedule an appointment? Again, there's two different ways that you can do this. You can do it online at www.carehere.com. And one of the nice things about scheduling an appointment with carehere.com is that you have access through any type of computer. So you can use your personal computer, your work computer, but you also have access through an iPad, any type of tablet, or a smartphone. So you can be on the go, you can pull out your smartphone, pull up www.carehere.com, and be able to schedule an appointment at that time. You also can do it through our help desk, which is our 877 number, which you'll see at the bottom right in the slide. So if you would like to do it online, we're going to walk through that really quickly. The first thing, again, you're going to go to the home page and you're going to click in the top left, the member login. It's going to bring up the Baytown schedule EMR page. What you're going to see on the left in the green bar is the appointment button. You're going to click on that, and then it's going to bring up the Baytown schedule. In the upper right-hand corner, you're going to see the calendar. What you'll do is you can go through there and pick the date that you would like to register for. Once you find your date, at the bottom of the screen, it's going to bring up that day's schedule and let you know which appointments are available. You can look at it and you'll see, for example, if you're looking at 8:40, and if there's already an appointment scheduled there, it's going to be blocked. You're not going to see anybody's their information, their name, or any of that stuff. You're just going to see that you're unable to schedule there. So what you'll do is you'll pick a time and you're going to click Make Appointment. Again, when you schedule an appointment at CareHere, we schedule 20 minutes appointments. Now, we schedule 20-minute appointments for if you have a cold or a sprain or a strain. If you're coming in for a physical or a well woman exam, or if you're on maintenance meds and you need more than 3 medication refills, we ask that you schedule a 40-minute block, which means that you'll have to schedule 2 back-to-back appointments. Once you get into the scheduling module, you'll see above the schedule a list of some directions. So what it's going to tell you there is basically what I just went over about scheduling, and it'll also let you know if the clinics are closed or any updates that might be happening at that time. So once you click on Make an Appointment, it's going to bring up the appointment scheduler page. And what you're going to do is you're going to see where the green arrow is. There's going to be a drop down there, and you're going to select your name. And then in the comment section below, what you're going to type is why you're coming in. So if you're coming in because you have flu-like symptoms or because you strained your knee or something, then you click that there, you type that in there, and then that will allow the clinic to know what you're coming in for. Also, if you type in you're coming in for a well woman exam and you only schedule 1 appointment, our medical assistant on a daily basis will be reviewing the schedule, and that'll let her know that she needs to go in there and block the extra 20 minutes so that you have the right amount of time with the provider. A few things that we recommend is that at this time, once you've viewed this slideshow, is to go ahead and register. Because if you wait 6-7 months or when you're sick or any time like that, it's going to be more difficult to register. So now that you've seen the slides, we suggest that you go into our system on www.carehere.com or by calling our help desk and go ahead and get the registration done. That way, if you do need to access the clinic, you can do it and just be able to schedule the appointment easily. We also recommend that you go ahead and put the 1877 number for our help desk into your cell phone. This will allow for, if you have an appointment and you're running late and you know that you're not going to be able to make it, you can go ahead and call the help desk and cancel the appointment. That way you do not incur the no-show fee. Again, with CareHere, you have the ability to schedule or reschedule or cancel any appointment on CareHere.com, and you can do this through your mobile device or iPad or any type of tablet or anything of that nature. So you also have the ability to pull out your smartphone, go to our webpage, and cancel the appointment at that time.